Hello, my name is Dr. Brian Reid, and I am a naturopathic doctor. And this is a video about using intravenous therapies in patients who are suffering from complex chronic illness slash chronic disease. And kind of within this framework would be, or within the umbrella of that terminology in the context, the case of this video at least, is patients suffering from chronic infections like persistent borreliosis or co-infections, chronic or reactivated viral infections, and mold illness would be the main things under that that I'm addressing in this video at least. So when it comes to intravenous therapies, there are lots of intravenous therapies out there. There are therapies that are used to help replenish nutrients, certain therapies that are geared at helping to support mitochondrial function, certain IV therapies that are geared at promoting more detoxification. And then, of course, there are antimicrobial slash anti-infectious IV therapies to help kill off microbes, reduce the viral the microbial load in the body. So the question mark is always, well, which therapy is going to be the best or the best suited, at least for the patient at a given point in time? To use a couple of examples, within the last several months in my practice, I had two new patients that came in to see me, and they were almost identical. Like, they didn't know each other. They were living in different parts of the province where I practice, but very, very similar, length of disease. They were in a, very similar demographic category, and they were both dealing with a combination of microbes, Borrelia, Babesia, or Bartonella, and some increased viral titers, suggesting in their cases probably a chronic viral component to things, or at least a reactivated viral component to things. And so the reason I mentioned those two cases is because, of course, everybody's different and unique, but they have very similar cases overall. And the one case, we started her out with high-dose nutrient infusions, so kind of like a Myers cocktail, which is high doses of B vitamins and minerals and trace minerals, but we take it a step further and add in fairly high doses of certain amino acids. We add in additional, even higher doses of some of the B vitamins. We have we add in high doses of specific B vitamins over and above what's in a typical Myers cocktail. We put in some intravenous NADH, which helps to promote mitochondrial function. So it's a higher potency nutrient infusion. So we call it a high dose nutrient infusion. And she did really, really well with that. She'd get an energy boost. Like, she got an energy boost after the first treatment. It lasted for a couple of days, which was nice because she'd been suffering from really debilitating fatigue for quite some time. And then we found that the subsequent treatments that she did, they just seemed to work better and better, last for longer and longer. We saw this really nice cumulative effect with those nutrients. The other patient, we started her off on the high-dose nutrient infusions as well, and she didn't really see any effect at all. She just felt pretty much no different. Thankfully, she was noticing some stepwise improvement with some of the herbs and oral mitochondrial support supplements that we were working with, but she definitely wasn't getting a nice pop in energy or feeling better or any discernibly different at all after the couple of high-dose nutrient infusions that we did. So we switched gears over to a combination of intravenous ozone therapy, piggybacked on intravenous laser therapy, and which intravenous laser therapy, especially when it's combined with photosensitizers, is the strongest antimicrobial treatment I've found in practice so far. I'll talk more about that in a future video, I'm sure. And so she found that she was noticing benefit from those treatments. So the high-dose nutrients, really no difference. The intravenous ozone plus IV laser therapy with photosensitizers, she was noticing a clinical change from that. So noticing that she felt better when it was just ozone and laser. Adding in the photosensitizer, she started to herx a little bit if we built it up too fast, because the photosensitizers really, in my clinical experience, dramatically increase the killing potential of or killing potency of the intravenous laser therapy. So I mentioned those two cases just to illustrate that it really, there's no one-size-fits-all treatment. We might think, oh wow, like this patient's been suffering from chronic illness for quite some time. They're really, really depleted. Nutrients are going to be a slam dunk for them, or ozone therapy is going to be a slam dunk, or there's going to be, definitely benefit from this or that therapy. And unfortunately, it doesn't play out that way. There's no perfect therapy for everybody. And it really just comes down to trying to select the best therapies depending on where the patient's at. If the patient's really sick and debilitated and depleted, probably don't want to start with those high potency antimicrobial therapies because they're probably going to hurt a lot from those. You probably want to build them up first. Patients who are already kind of hitting the ground running with oral nutrients like mitochondrial support and things like that, they're the patients that generally, in my experience, aren't going to benefit as much from those high dose nutrient infusions because in those cases, clinically, it seems like their bodies are able to rally quite a bit faster than patients who might otherwise feel like the oral stuff is working too slowly, but then the IVs are helping quite a bit. So it's quite nuanced, but the long and short of it is there's lots of IV therapy options out there, and selecting the right type is really the art form of practice. So I hope that information is helpful.